Good morning. Today I have a guest, Professor Supten Sarbadhikari. He's a medical doctor by profession. He also has a PhD in biomedical from BHU. And over the last 30 plus years, he has held some of the very prestigious positions within Indian digitalization initiatives. So with that, I will pass it on to the Professor Sarbadhikari and let him tell us a little bit more about his journey and how he got to digital health, what triggered his interest in digital health. Over to you.
Thank you very much, Chiranjeev. It's an honor to be present with you. Actually, the journey started in a very interesting way. When we just passed the medicine, we were doing internship. So that time I had read about a professor in the USA, Professor Ralph R. Grams. He was actually in the University of Gainesville at Florida. And he was involved with the telemedicine program for the space scientists in NASA. I mean, so those who are going to space, how do we keep a telemedicine contact with them? So that was in India, it was a really pre-internet era. So I sent him a snail mail and also got a reply. That was a quite pleasant surprise. And then after that, I thought I should actually go into something like this, informatics. But that time there was no informatics course available anywhere in India. So I actually wrote to some of the US universities, and all of them said that we expect you to know the basics of computers. So I was thinking, should I enroll into a course of NIIT or something like that? And then I got this opportunity but then that was IIT-BHU, Banaras Hindu University in Varanasi. Now it's the IIT-BHU. So they were offering a PhD in biomedical engineering to medical graduates. I mean, they're giving stipend for that, for the PhD program. So I applied for it and fortunately got it. So it was a roundabout way. So I worked in biomedical engineering, but the work was on really a decision support system, so more towards health informatics. So that's how I took the roundabout, but somehow or other, and that was 95. And in 2013, I actually joined the Union Health Ministry as the project director for Center for Health Informatics, the first of its kind in India. So that way, I think I could justify the means.
The pioneer of digital health in India, absolutely. See, if you look at it, even US healthcare system didn't truly transition to digital till late 20s, 2000s, whatever we call that. And I've been engaged in digitization of healthcare in the US side. And in early 90s, it was all disparate systems. So you have lab system, you have radiology system. Very few hospitals have true integrated EMR at that time. Actually, there was not even a single vendor who was producing integrated EMR. It was all interfaces between all the systems and then creating something called computerized physician order entry system, from where physicians can enter orders and those orders will get that transmitted to ancillary systems, and then the results will come back and the physicians can see it. But it was very
standalone systems, and no one was thinking of interoperability at that point of time, I think.
Correct. So tell me about that first initiative that you took. What was the objectives of that initiative?
So initially, actually, I went into the academics. So in medical colleges and engineering colleges, I was a faculty in the IIT Kharagpur. So I was the first faculty to join the School of Medical Science and Technology. That was in 2002. Then from there, I shifted to Amrita. Then I was also with the PhD group. And then subsequently, I got a Rockefeller Foundation support for being a visiting professor in health informatics in Bangladesh. So I was there during 2011-12, during which time I was also the chair of HL7 India. So I was visiting US and other countries for the HL7 work group meetings 3 times a year. And that's how things started crystallizing. And so 2013, I came to Delhi and started the Center for Health Informatics. And we really kicked off many e-health programs. I mean, the first set of e-health programs that time. We actually had the EHR standards notified by the ministry in 2013. August 2013 was the first edition that we brought out. Subsequently, it was revised in December 2016. The second edition came because in 2014, India became a member of SNOMED City. So since 2014, India is a country member of SNOMED CT, and gradually, but the problem what happened is, though we had the EHR standards, but EHR is as of date not legally mandatory in India. So that leaves a escape way for many people who are not willing to join the bandwagon.
Correct. So what, in your opinion, I know, I don't know if the government of India has done any true statistical analysis. What is the current adoption rate of EHR, EMR within large provider? And I'm saying large provider means hospitals with at least 50 beds.
If you're talking about digitalization, so some sort of an hospital information system is there in almost everywhere. The only problem is we don't really have the clinical information system part, the real EHR, electronic health record, electronic medical record. The clinical information system part is not there. I mean, we have the admission, discharge, transfer, the ADT, finance, billing, those things are there. So I think that's very important. I mean, if you really want to work, I think on the health outcomes, improving the health outcomes,
Correct.
improving patient safety. I mean, the EMR system is the bedrock. Even for SNOMED City to work, without an EMR, SNOMED City is nothing.
Yes.
So I think we need to focus on the basic first, and that I think is where we are really lacking. So although we were pretty early in recommending standards, but we still don't have the infrastructure to really leverage on that.
So what, in your opinion, are the blockers? So whenever I talk digitization of healthcare, I am more interested in medical records, not administrative systems, right? Because like you correctly said, true benefit of digitization and improving patient safety and improving patient outcomes is only driven by having relevant medical data available to physicians at point of care. If it is not available at point of care and they cannot make decisions on it, then we are not going to be able to improve patient outcomes. So with that premise, like, what is the adoption rate? And if it is not at the rate where we want it to be, then what are the key blockers? What are the key challenges? And what are we doing collectively to overcome those challenges?
I mean, as far as genuine, EMR is concerned, I would say adoption is next to nothing. I mean, very few cases, isolated centers of excellence may have some clinical data. But in general, we still don't have the reason. As I said, we can have a top-down approach. We can have a legal mandate, which is not there yet. Or we can have a bottom-up approach where the user demand. I mean, everyone comes and says, if I can't access my record from anywhere in the world, I'm not going to come to you. Whether it's a single doctor clinic or whether it's a big hospital, if people start demanding, that's bound to happen, whether there's a legal mandate or not. And of course, I think India is a big hub for medical tourism. So even for medical tourism purposes, I think that's necessity. So obviously, those hospitals which are catering to a large number of people coming from medical tourism, they are the ones who are more interested in adopting. But then those are really the high-end ones. We really, with a population of 1.4 billion plus, I think we need to really cover the grassroots level. And this population, actually, we can think of it as a dividend. The amount of data we can have. In fact, a good example is what happened during this COVID vaccination, because vaccination, we have done a pretty well. And even for COVID-19, I think India has been one of the leaders in the world, the way it has vaccinated, the number of people vaccinated, the number of doses given, and the records totally digitized. You can get a QR code, you can scan it anywhere in the world, and you'll get all the details. So that way, I think we are definitely leveraging digital technology for health. But as far as day-to-day patient care is concerned, I think we still have a very long way to go.
So here's a question that, see, when I started my journey within digital health in mid-90s, there was no government mandate that you need to put EMRs in hospitals. And it was mostly at a hospital level, not at individual physician practice level. 4 or 5 practicing physicians will not do it because it wasn't cost incentive wasn't there, as well as most of those physicians were older physicians in 90s, and they actually felt that going EMR from paper will slow them down and will adversely impact their revenue stream. But hospitals had the foresight. They saw that getting all this data is good, and getting that data in physician's hand at point of care, is going to help them in improving patient safety, improving patient outcomes. So it was driven by those administrators within those hospitals who had that vision. Now, consumers, even today, even in developed nations like Canada, we don't think that we have the influence to dictate terms to physicians. Having worked in university, so you have both the top slots. I always believe that physicians are next to God, and then comes professors because they change people's life, they influence people's life like no one else. So it is very difficult for individuals to go and tell physicians or professors to do their job different ways. So in my opinion, adoption of EMR has to come from physicians and intellects like you, who are at the forefront of it, and then saying, okay, guys, we need to change our policy, we need to move. Don't take me in a wrong way, but the influence is there with that group of people like yourself who are at the forefront of it, and also have medical degree to say, yeah, it does not impact my medicine adversely when I'm providing care. It actually helps me. So why that is not happening? Why physician community and leaders are not pushing for this thing?
Yeah, again, I think the physician community here, the biggest problem is again the numbers. I mean, the number of patients which comes to any hospital, private or government, is mind-boggling.
It's mind-boggling.
I'll just give a simple example. A few years back, a professor from Canada actually had come. She was working on a particular set of disorders. So she came to Sankar Netralaya in south of India. And she said after that, I mean, she spent at the end of one day only, she said, I have seen that many cases which I see in a whole year in Canada.
Indeed.
I mean, that's the level of, difference in scale.
Indeed.
So when you have just so many patients, you just can't think of doing anything else, just how to dispose of the patients as early as possible. And that I think is a big problem. That this digitalization helps. I mean, we understood the hard way during the COVID-19 pandemic when it came, when there was no other way. Then people, both physicians as well as patients, realize that a lot can be done without visiting the doctor's clinic or hospital.
Absolutely.
So that way now people are more open to it. So hopefully now adoption would be much faster than it would have been, say, 3 years back.
So do we have a homegrown EMR software packages that can be installed at a much lower cost? Because
yes, there are many. Literally, almost 3 figures number of vendors who are giving different. It's not one size fits all, so you have to customize according to the requirements. It's there. Not that all are standards compliant, but then there are some EMR vendors in India who are also very meticulously following the standards, and they have showcased it in multiple occasions for this Global Digital Health Summit and so on, wherever it's possible, that they can also exchange the data between their disparate systems, 2 or 3 or 4. So we have even that sort of vendors already here. But as I said, the push is still not there, neither the push nor the pull, from the top or the bottom. So I think we still need to wait a bit, and we need to go on showing the value addition that, okay, because these people are using such standard compliance systems, it's actually improving health outcomes.
Okay, let's take a segue and go to the AI side of it, which is the task force that you're leading right now. So share with us, what is the mission of this task force and what initiatives you guys are working on or are in the pipeline?
Yeah, this is actually under the aegis of our National Academy of Medical Sciences. So we are just trying to, bring forward some useful use cases, which would show that AI really works and works well. And these things we should be trying to adopt as early as possible. So this is going to be like a white paper. It's just the sort of recommendations or guidelines, best practices.
Okay.
Now, adoption part, again, as I said, we are already bought into it. So it's really for the others, the new people or who have not yet used. So I think that's very important. So if we look at it the other way, this is one end, but like if we look at the education part also, like in India, medical education is regulated by the National Medical Commission. Similarly, we have the Indian Nursing Council for Nursing Education. Now, National Medical Commission is still not very clear about this informatics or digital health as such. They have introduced a foundation course which has got computers, but again, that's more primitive. Whereas the Indian Nursing Council in the BSc, that's the undergraduate program for the nursing, in the second semester, they've introduced a whole subject on health and nursing informatics. So I think that's very important. I mean, they need to know right from the beginning when they're starting. And then by the time they reach the workplace, they get those systems so that they can easily work with it. So I think we need to have a very robust capacity building program for human resources of health. All the healthcare professional education, so doctors, nurses, allied health professionals, hospital administrators, everyone should be aware of this. Otherwise, I think this is not going to work. I mean, if just one group of people say we need it, the others would say, oh, we can do without it. So I think there's a concerted effort required from all the health professional educations. It's not just the doctors.
Fair enough. Fair enough. So share with us some of the use cases that you are putting together the white paper on the AI side.
Yeah, we are trying to see from the different aspects. I mean, all the things. I mean, see, AI, where we get a lot of useful cases. I mean, one is the diagnostics, and that's also very, I mean, attractive. Clinical decision support systems, obviously, but then that's one part of it. But even for the administrative workflows, a lot of things can be done. In fact, in the hospitals, because I was saying about the numbers and scale, turnaround time itself is a huge problem. Those are the things which can be easily tackled. Those are the low-hanging fruits. And there we can actually show that these can be also translated into the financial numbers, which the administrators look at more. So across the spectrum, the healthcare delivery, as you know, is a whole very complex system. So what the doctor or the nurse does is a small part of it. There's so much more to it. And we are trying to actually put in all the use cases for all the things, whoever is, I mean, attached to healthcare delivery should be finding something useful and start using. I mean, once you use, because see about AI, what is said, I mean, sometimes people do ask, I mean, is AI going to replace the doctors? The answer is obviously no. But AI, what will happen? The doctors who use AI will replace the doctors who don't.
Correct.
Because brain and computer together is always better than, greater than either alone.
Absolutely. Absolutely. It's a sum total of the technology. And even in future, technology will get to a point where doctors won't even realize that they are using AI, because it's just like my phone, right? So if I have a flight in the morning, Google is telling me that you're late, you're still home.
Yeah. And also, yeah. And also what will happen, I mean, since there are, I mean, if you look at it, I mean, medical knowledge right now is doubling in about 2 months' time. So human brains simply cannot keep that. So we definitely need support from AI and other tools of technology, because when we need to think of so much knowledge is coming there, I mean, it's an information explosion, and how to optimize that so that we can use it for the best purpose of that patient in front of me.
Absolutely.
And that's
And
how the
you
health
did your
outcomes can
PhD
be.
in medical devices. So medical devices exploding, right? Internet of Things. We're going to get scanners everywhere, right, left and center. Those
In
scanners
fact,
will be
that's,
capturing so much information.
yes,
Now,
yes,
all that
that's
information, 98% of that information may be irrelevant, but that
yeah.
2% to plow through that gigabytes and terabytes of data is a job of our computer. That only 2% is presented to physicians. Otherwise, they will get overwhelmed with the amount of data coming right, left, and center. So
Yeah,
yes,
that's what's happening actually. I mean, patients in bigger cities, they are using all these Fitbits and Apple Watches and so on, and they expect the doctor to utilize that data to give them the best management. But the doctors are at a loss if they're presented with the data. So that's very important. I mean, absolutely important. I mean, unless you, as you rightly said, filter and funnel and give the minimum necessary things which would actually affect them. So that's very, very important. And for that, what's needed is really health data literacy and digital literacy. That's digital health literacy. So health data literacy, unfortunately, is lacking among all. I mean, not just patients, even doctors. I mean, we are not really health data literate that way, but I think that's something needs to be taught right from the very beginning of all the health professional education courses.
I think you're hitting the nail right on the head. That's the most important thing. We need to integrate digitization of healthcare at university and medical school level. So these professionals, when they are graduating, they are in tune with these things. And then the
So one
adoption
of the
rates
ways
will
which
improve.
the regulators can actually do, I mean, they have a lot of control. In India, I mean, it's the regulators really dictate what's to be done. So if the regulators also say that any medical college hospital must have a standards compliant EMR system to be recognized, that itself can do a lot of work. But then we still don't have something like that.
That was the strategy actually done by Epic very nicely, because they gave away their software at a much discounted prices to teaching hospitals. So when the physicians were coming out of those hospitals, they were more in tune with these things. And when they went into their career, grew in their career, they took more of bias towards that software because they have used it and they understood the benefits of it.
In fact, just about 3 years back, I saw a note from a professor of health informatics of USA that I got an intern who's the first I'm seeing in my life who has not used pen and paper for medical records. So that was just 3-4 years back. I mean, 2020, 21. So even USA is like that. So we have that advantage. We can actually leapfrog on that, but then we do need to have the systems in place.
Absolutely, absolutely. We are at that bottom of the hour. I know we wanted to stop at that 20-25 minute mark. It has been an interesting conversation with you. I wish you all the very best, and I would love to have more conversations like this from time to time and see how the landscape in India is progressing. Being from India, I have a little bias.
No, I have also thoroughly enjoyed this conversation. I mean, this sort of free-flowing conversation really, I think, adds value rather than a didactic lecture.
Agreed, definitely. And we bring different set of experiences with each other, and we have to build on that. So thank you so much. And again, wishing you all the very best. That is all for today. Thank you for watching. I would love to hear from you and answer any questions you may have. You can reach me at cjdevgan.com. If you enjoyed this episode, please do not forget to like and subscribe to our channel. Let's go out and break barriers and generate new possibilities. Until next time, adios, ciao, and goodbye.